Morning, everybody. We're going to give it just a minute. We're missing a few. Let's see if they'll get us on. If not, we're going to see if we can reach out to them and get them here with us. So let's just give it a minute. Are you all getting that tired, worn out, beat feeling? Or have you arrived? Okay, we're getting more joining us, so hang on just a minute. Well, let me just give you guys kind of a heads up on today and the rest of the semester. I'm only going to have you for about 45 minutes to an hour this morning. I know you have lots to do. We're going to try and just review a little bit for ATI. Then I'm going to let you go. So we don't need to take a break. We're going to just go in about an hour. Hang on, I got more people coming. All right, Kirsten Anderson, are you with me? And I don't know. Carla, Anna, Nancy Williams. If any of you know those people, let's reach out and help our fellow cohort. Remind them you got to come to class today. So if any of you know the people that were missing, we've done that yesterday and we managed to get everybody on. So should you know anybody who is missing, just reach out to them if you know how to and see if we can get them on. Anyway, just so you know that this class is going to be just about an hour today and that's it. Next week, we will not be meeting. You'll be doing your ATI at 7 in the morning. I'm proctoring it. So as you go on, it'll register the name so I can do the attendance and then you take it. Then when you are done taking the OB, you are done for the day with OB. I am not lecturing and we're not meeting next week. A lot of the students are confused because we're doing a combined class today. Now that you are here, you are not required to go to PEDS in the afternoon, whatever day that you have it. You don't have a PEDS class today.
Joyce?
Yes.
Carla is trying to get in, but her internet's not working.
Great. Okay, good. Thanks. Kirsten. And Anna Wallace, if any of you know Anna or Kirsten, shoot them an email and let's make sure they're all right. So we won't meet next week. Some students are confused because we're having a combined class today. Also, if you have to do the retake for ATI, that is done on finals week. And that is kind of a combined thing as well, but not next week. Next week, go do your OB in your OB class, your PEDS ATI in your PEDS class. On week 15, if you have to do the retake, you can do PEDS or OB. Do one, go to the BR, come back and do the other one. So it moves kind of quickly there. Next week, after you do your ATI, if you get a level 3, I'll be putting in that score right after the exam is done. If you get a level 2, as soon as I get those 5 remediations, I will put your 90 in. And with everyone else, when you get me your score, I'll put it in. Don't forget, when you do the retake, it's always a lot easier than the first one. All right, we got everybody with us. No, we don't. Kirsten. Kirsten, anybody know Kirsten? All right, well, if you do, shoot her an email and let's make sure she is all right and gonna join us. On week 14, it is our final study guide review. I've had several requests. Would you please do it in person? We have finally got that organized. So on August 2nd, I will be doing an on-campus final review at 2 o'clock, and I'll be sure that it is recorded for those of you who cannot make it. Although I am going to still do the review pretty thoroughly in class during that week. Please don't miss any of the weeks. Your attendance goes clear through week 15. So please be careful on that. But in any event, Joelle just got back to me and said that review will be in room 204. I think it's B, but if it's not B, it's A, and it's in 204. So if you can make it, it would be good. But a lot of people feel like an on-campus in person would be a better review. So that is available to you August 2nd, week 14. Week 14, when you come to class, of course, that'll be a Zoom class. And we'll be going over the final fairly thoroughly. If there's any concept that you don't get, that's the time to ask me. I can also do private tutoring with you. If you feel that you're struggling and I'm just not going to make this class, let me work with you one-to-one and we'll see if we can't help you out what you're lacking there. Then week 15 is the final, and I believe our final is on a Wednesday. I don't remember, I don't have it right in front of me, but I think that's the deal. Any questions for me so far? All right, yesterday I had a bit of a problem sharing some of this stuff because they are working on my Canvas for next semester and they eliminated some of my things. As a matter of fact, all this was under week 12 and it is now gone. So let me pull up a couple of the things. Ashley tells me that she already uploaded this particular piece of information. I made this up, and then from last semester, she uploaded it already. If you don't have it, let me know, and I'm still gonna upload it. You see that dog right there? No? Okay, let me do it one more time. Yesterday, this was a bit of a problem because of they had removed so many things. All right, here we go. Now, do you see the dog? All right. So Ashley tells me that she sent out this paper that I had made up from an ATI conference I went to. So I'll be uploading my OB stuff and then a couple other things I'll show you. I went to the ATI conference and they tell me, no, you cannot see the test. Well, I met with people that actually write for ATI testing. Some of the things that they pointed out and gave me, they said the nursing test has 3 main parts: understanding the question, application of the content, and content mastery. Understanding the question. This is the easiest of all the problems to overcome because it's surprisingly very common. We have gone over tests together. You have made appointments with me and we've gone over your test together. Please don't jump to a conclusion on a test question. Many of you that have done this said, oh, I don't know why I answered that. That wasn't the correct answer. Right. So try not to jump to a conclusion in the middle of reading it. You can't rush a nursing test. And by the way, there are 70 questions next week on the ATI exam for 70 minutes. They're figuring a minute per question. The majority of the students finish this in about 40 minutes to an hour. All right, tips for understanding the question. Now, these are all suggestions from ATI. Always read the entire question. After you ask yourself, what is this question asking me? If you don't know, read it again. Look for keywords in it like appropriate, highest, priority, safe, therapeutic, first, best. We've had test questions that did that, where they want to know, what do you know as the nurse? For example, that one test question we had in OB test 2, mom was given fentanyl. What is the nursery nurse's priority? What is her first reaction? Well, if you were a nursery nurse, you're taking care of the baby. So mom was given fentanyl, baby's probably a little on the sleepy side. So ATI is looking for least invasive to more invasive. Least invasive is stimulating the baby. Wipe it off. That's it. We're not going to run and get Narcan or O2 or do Apgars. We first are going to stimulate the baby. So you're always looking for the key words. Then application. If you look at that and you are not quite sure what you're looking for or what's the question's priority, think of ADPI, Maslow, ABCs. Think of the critical part first. And if discerning the best answer is your only problem, the best fix, which they recommend, is doing the ATI practice questions and or going to Picmonics. Then they said, mastering the content. You're going to see questions that you're going to say, oh my gosh, I don't remember any of that. I don't remember that. That's because ATI has the ability to take a little tiny paragraph. For example, in your PEDS ATI, they ask this every time, but it's only about that much in your book about intracranial pressure. Please review that. They always ask that in PEDS. It's just a little paragraph, but review that. If you still do not remember which disease, drug, or bug the question is actually asking, do this, a self-assessment. What do I remember? What do I know? Then do not do this where you start studying the night before. Hopefully you've kept up on your ATI reading and you are doing practice questions, but they said don't start it the night before. Then ATI told me about the STOP approach. The S is for story. Every scenario is because there is a problem. The patient has a problem. Well, no kidding. Why would we write about somebody healthy? Every scenario is about somebody not doing well. Let's say a medication that they're asking you about, magnesium sulfate. You say, because your test anxiety is up, I don't remember anything about magnesium sulfate. Then pretend you're teaching it to somebody else. I have terrible test anxiety, by the way, myself. That's how I got through the NCLEX. If I came to something I didn't get, I pretended I was teaching it to a fellow student. Well, let me tell you about magnesium sulfate. We give that for preeclampsia. Oh, yeah. Now, if they become mag toxic, what does that look like? Well, decreased respirations, decreased DTRs. It's a smooth muscle relaxant. What am I going to give her if that happens? Calcium glutamate. Tell yourself a story and you're going to get it. One of the areas that I see when I get the report back from ATI is that our students may know a diagnosis, but they don't know what their nursing intervention should be. For example, you have a patient that is in latent phase, 0 to 3 centimeters, and she's complaining of pain. What would you do for somebody at 0 to 3? Well, we have all kinds of non-pharmacological interventions, right? And so we would use that. ATI basically is wanting to know, you as the nurse, how do you as the nurse going to take care of this patient with this diagnosis? You have somebody with placenta previa. Well, what are you going to do as a nurse? Well, number one, I'm not going to stick my fingers in the vagina and go through the placenta because I know that a previa is a low-lying placenta. So when you look at the problem, then you have to realize, what am I doing as a nurse? With behavior, when we're looking at a PEDS situation, Kawasaki disease, for example, those kids are so agitated and so restless. What would you do as a nurse for them? Let's try and refocus them. Let's try and remove them from the situation. We're going to get them more calm and more relaxed if we can. Now, if the disorder is a diabetes disorder for children, they always say, what are you going to do for a child with diabetes on a sick day? Well, mama, you're going to have to do more blood sugars. You might have to give insulin. You might have to decrease insulin. So you'd be monitoring that child even more. For OB, you are thinking, how does diabetes affect the mother? Well, she could have a stillbirth. She might have to have a C-section. The baby might have a shoulder dystocia, which would be more lacerations for her. Then you're thinking, how does this affect an unborn baby? Congenital anomalies. Baby might come out with a shoulder dystocia or a broken clavicle or arm, and for sure they're going to suffer hypoglycemia. So when you're looking at the disorder for OB, think of that, how does it affect the mother? How is it affecting the baby? Now with an amniocentesis, what is one thing after an amniocentesis that I'm going to do? What is one thing as a nurse that I'm going to monitor?
Infection.
Infection, and what else?
They may need ROGAM.
Yeah, if she's Rh negative, she is definitely going to need ROGAM. Good. What about that baby? You've just done invasive procedure. You got to put that baby on the monitor and make sure our baby's okay. So once again, they're saying the client in question usually has a health problem. Well, we know that. So that is what we're figuring. The T in stop is, again, looking for key things, key words. What is the stem? What are they asking about? For example, postpartum hemorrhage, they were talking about the early signs and the late signs. The O in stop was consider potential responses. Look at each option one at a time after you've told yourself a story, and then pick one. Pick the answer, and then they recommend do not change it. Don't change your answer. All right, let me show you this. I will be uploading this to you. Let me pull it up here. I do have a couple of things that I've been trying to upload to you and they're not going through, so I'm either going to have to retype them or whatever. Can you see maternal right here? Okay, I made this up a while back. Please, please, people, don't think this is the study guide for ATI. What this is, it's what do I remember for OB? What, just kind of some of the things, what do I remember for OB? For example, I started off with diaphragm. Should be left in for 6 hours after intercourse. Use water-based. This is a self-test that you would do for yourself. For example, Nagel's rule, ROGAM, prenatal labs. This is just what do I remember? It's a good study guide toward the ATI, but it's not all that you have to study. I've gone through many of the problems with breastfeeding, oxytocin, preterm labor, and then I want to go down. Then I went into more high-risk stuff like magnesium sulfate, non-stress test, fetal monitoring. Let me go down to right here where I talk about, and then I picked it up with the newborn. The newborn, you're gonna do APGARs at 1 and 5. So you fill this in, you're not graded on it, you don't even have to do it. Some of these are already filled in that you can just read, but it just kind of gives you an idea, where am I at? What am I looking at? And then I've done circumcisions. Then I went on to PEDS. With PEDS, how do I treatment for impetigo? It is caused by strep or staph. What are you going to put on? Bactoban ointment or Burrows solution. I go through the milestones for children, some of the surgeries, some meds that you've talked about in PEDS. Now we know methotrexate as being taken with an ectopic pregnancy because it dissolves the pregnancy with an unruptured ectopic. But did you know that methotrexate is also used for rheumatoid arthritis in children? So I put that down. It talks about some of the other problems with children, myelomeningeal. Anyway, it goes all the way through that. And then let me show you this. So that is just kind of like a study guide for that. And then hopefully you can see this. I'm going to stop sharing and bring it up again so you can see it. Do you see the red on here? This is the answer sheet. So if you want to test yourself, I've already also supplied the answer sheet to check. So you can go through this and see what you remember, what you don't remember, maybe what areas that you might need to review. Abruptoplacenta, risk factors include hypertension and cocaine. Also more than one fetus, hydramnios, too much amniotic fluid. So it just kind of goes through a lot of this information that we have gone through, but that'll be a great study guide for you. Does that make sense? Okay, I have asked Sherry a couple of times, which has not worked out well, if she got this in her email. So what I did, and I'm going to try it again, just going in a different way. I did labor and delivery medications. I've showed you this before. I'm having a hard time uploading it to you, so I'm going to have to either do one of two things. If this does not come through today, I need one of you. Sherry's been really good with helping me with this. I'm going to upload this off a different angle. Sherry, if you'll let me know again, if you get this later today or not. If you don't get it, I'm going to try to retype it and send it again.
Okay.
And then So it's the labor and delivery worksheet and another sheet that I have. All right, I want to do about 15 OB ATI questions. These have been used in the past. I cannot upload this to you. I have about 100 questions. Because of copyright issues, they will not let me do this. But because we're recording this, you'll at least have 15 of them that you'll be able to listen to and review. So let's see kind of how we do on some of these. You will find that OB is a little bit easier than the PEDS one. PEDS is all about disease. All right, let's see how we do. Now, I can't see the chat when I have this up. So if you know the answer, just tell me and let's go through about 15 of these. We'll do 15 PEDS and then we're going to call it good. Clients receiving teaching about oral contraceptives. What's a danger sign you want to report?
C.
C.
That's right, C, chest pain. All right, let's go down to this one. Nagel's rule, what is her due date? Off that
September
information.
8th.
Yeah, September 8th. You subtract 3 months, add 7 days. Good job. Don't forget to change the year. Here is a GTPAL. What is her GTPAL based on this?
She's G5.
Yes. Good. What's the T?
51213.
5, 1, 2, 1, and viable or living 4. Make sense? So you've got
Wait, how does she have 4?
one baby here, 2 twins, 3.
Oh, I missed the twins. Okay,
Yeah, that's all right. Good job, Elizabeth. Good. So she is a gravida 5, 1, 2, 1, 4. Good job. All right, let's try this one. Which signs of pregnancy is considered probable? You've got presumptive, probable, positive. The easiest way to remember this is, can she do this on herself? Can she do it herself? So, amenorrhea. I presume I'm pregnant because I didn't have a period. But she cannot do Goodell, Bellotment, or Chadwick herself. A provider has to do that. So those 3 would be probable. Quickening. I presume I'm pregnant because I felt the baby move. Well, it could be gas too. So that's how you do these. Don't get tripped up by some of these. Let me ask you this one. A couple seeking infertility counseling tells the nurse that a man is a cancer survivor, has 1 beer every night with dinner, and takes a sauna every day after work. Which of the following is an appropriate response? Let's see how you do with this.
C.
Did you say C?
Yes.
Yeah, and that would be correct. A, you can rule out because obviously one of these do impact, or we wouldn't have the question in here. Daily alcohol does not usually cause infertility problems, but I will tell you one that does is marijuana. If a man is taking marijuana, they have documented this pretty consistently over the last several years, that if a man is taking marijuana and you are not getting pregnant, it can affect your infertility. So any of you that are suffering from infertility and have a guy that's on marijuana, that could be your problem. C is the correct answer. If you want to cook your boys every night, then that's going to affect your sperm. So don't be cooking anything in your underwear area. All right. Let me ask you about this Depo. How do we give Depo, by the way? How is Depo-Provera given?
IM injection.
That's correct. So you can rule out A, right? Because it's not a pill. So now you got 3 left. Which ones do you think it would be, or which one?
C.
It's actually D. Did you say D? It is actually D. You can breastfeed with Depo. D, we have her switch out. Do any of you remember why we have her switch out? Because Depo causes osteoporosis. So you can be on Depo for a year or 2 and then stop. Let me get another one. Let's go down a little bit and see what we can do. We'll get a different perspective. We'll do 2 more. Some of these, like this one, you're going to know as soon as you see it. What calorie increase? 300 calories. So some of these you're going to be able to answer just boom right away. Let's see, let's pick up 2 more. A nurse is measuring the fundal height on a client who's 36 weeks gestation when the client complains of feeling lightheaded. What should she do? What should the nurse do? Your patient feels lightheaded. What do you do?
Turn her to the side.
Yeah, turn her to the side because that baby's laying on her vena cava. Good job. All right, let's do this one and then we'll go to peds. A clinic nurse is assessing a prenatal client with heart disease. The nurse carefully assesses the vitals, weight, fluid, nutritional status to detect for what? What are we looking for? Well, right there, you can rule out A because RH incompatibility would be done by lab work, not by these other things.
C.
Okay, the answer would be C. All right, good. All right, this will be our last one. Which of the following skin changes during pregnancy should the nurse inform the provider of?
C.
C, yes. So we know that linea nigra is just that line. Colosma is the mask of pregnancy. Striae are stretch marks. But if she has petechiae, now we're worried about a blood clotting problem that she may have. Let's go to the peds one. We'll do
I
a
have a
few.
question.
Yes.
That question that you asked a few questions ago, where the answer was turn her to the side if she was feeling dizzy.
Yes.
So my first instinct is to want to check her blood pressure.
I know.
So how do you, that's the problem. I know we mostly can get it down to 2 answers, but then
Right.
how do you decide that it's turn her to the side instead of check her blood pressure?
Well, you could check her blood pressure after, but we want to be sure that we turn her, assuming that she has got the baby laying on the vena cava, because we have her flat. So they said they had her flat, laying down, and you say, okay, well, that's got to be the baby's laying on that vena cava. So I'm going to turn her, and then if you wanted to do a blood pressure again, you could. But she's going to give you clues about that baby being on the vena cava. I feel dizzy. I don't feel well. Okay, let's get you off your back. That would be your very first interaction.
So
Then,
did it say in the question that she was lying flat on her back?
yeah, it said that she was on her back or she was getting a
Okay.
vaginal exam. Whatever, I
Okay.
can't remember the term, but they did say, indicated that she was on her back while they were doing a procedure. Can you see pediatric practice here? Okay, let me make this bigger. These are a little bit different of how we're going to look at these. So these answers, you won't see the rationale, but I'll do it with you. Okay, a nurse is providing teaching all of the peds.
Wait, sorry, we don't see it. We just see your list.
Oh, okay, let me.
We saw you clicked on it, but then it didn't pull up.
Okay, let's do it again. How about now? Can you see okay. A nurse is, now with peds, everything is related around a medical diagnosis. So the child has group A beta hemolytic strep. What are you going to include in the teaching on this for this parents? What are you going to tell the parents?
Replace the toothbrush after 24 hours?
Yeah, absolutely, because after 24 hours, they actually can reinfect themselves. Now, this one is on immunization. You got a 5-year-old. Which immunization are you going to give this 5-year-old? And by the way, ATI will be asking you about immunizations. I want to say varicella is correct because the baby's first dose is between 12 and 15 months. Then when they're 5, they get another dose. I'll tell you, I had a student in my class about 4 years ago, and I don't know if any of you know Arlene Griffith. She is a previous Ameritech student and graduated. She has helped a lot of students tutoring. She's pretty amazing, but she made up a video that I have. Ashley said when I posted it before, she already uploaded it to you. Have you seen the video from Arlene about that? I'm going to upload it to you then, because it's really great about how she came up with an algorithm to remember every single immunization that children have. It's pretty amazing. So I'll shoot that to you as well. It's good. So yes, varicella is the one. Now look at this question. You got a 4-year-old on airborne precautions. If you want to do an activity with this child, what would you implement for this child?
Airplane in the room.
Yeah, so they have, well, no. A 4-year-old probably won't be able to construct.
Puzzle then.
Yeah, puzzle. The other two are in a playroom or hallway. Well, in the first sentence, it says airborne. So, you know, he's 4. Peds will always give you the age of the child. Let me ask you this. You got an 11-month-old. What are the clinical manifestations of a CNS infection? What are the clinical manifestations that you would see?
The bulging fontanelle.
That's correct. If we have dehydration, you're going to have a sunken fontanelle. Any CNS infection, they're going to have a bulging fontanelle, which would still be open at 11 months. All right. The child has impetigo. Which of the following you're going to include? So ATI, as you noticed, always wants to know, what is the nurse going to do? So the child has impetigo. What are you going to do for this kid or teach the mom?
B?
Yeah, wash the toys. You're not going to isolate a child from his family. That's never going to work. We're not going to, there is no vaccination for impetigo, and implement no special precautions. Well, we kind of like to keep the toys clean. Let me go down to this one. A nurse is assessing a child. What are the clinical manifestations of nephrotic syndrome? What would you see with nephrotic syndrome? your first reaction might be smoky brown urine, but actually the correct answer is facial edema. So you've got glomerular membranes are permeable to albumin and is excreted, thus changing the osmotic pressure, which would cause facial edema. Let's do a few more here, and then I'm going to let you go. A nurse is teaching a parent who has eczema. What are you going to tell the mom? What are you going to tell her to do or not do?
A.
Yeah, you want her to apply a cool compress or a cool, apply a cool wet compress. Yes. If you use fabric softener, it's going to dry out their skin more. If you give them a bubble bath, very drying, and you put them in thermal, that's not going to work either. A nurse in a well child clinic is assessing now you've got a 6-month-old. What should you expect to find? What would you expect to find in a 6-month-old baby?
C.
It would actually be A. The posterior fontanelle closes at 8 weeks, so that would be normal. An infant's birth weight is doubled at 6 months, not usually tripled. And if they have upper and lower central incisors, they could eat steak at 6 months. And infants don't usually sit too well at 6 months without some support. Okay, I want to show you this one question that I did with some of the other students. Nurses caring for an adolescent with anorexia. What's a finding that you would see that is associated with this?
C.
It is actually D, bloating, bloating. How I want you to remember that is you think of children that are malnutritioned. Now with anorexia, you could have bloating and obviously bloating, but think of children in third world countries, how they have little arms, little legs, but they got big tummies from malnutrition. Anorexia, they are malnutritioned. They don't have diarrhea, they actually have constipation. They don't have hyper, they have hypoglycemia and usually bradycardia. So this is where you got to know every diagnosis for the peds. And then as you go through a lot of these, let me ask you this last one and then we'll call it good. A child who has leukemia is being admitted. Now you're the nurse. You're the nurse and you have to assign this little person a room. But who are you going to put that person with? You've got a child that has nephrotic syndrome. You've got somebody with a ruptured appendix. You have somebody else with rheumatic fever and somebody else with cystic fibrosis. Who are you going to put this child in with that has leukemia?
B.
It's actually A. A, those children are not infected. They have a nephrotic syndrome, but with an appendix, you can become infected or rheumatic fever and cystic fibrosis. But a nephrotic syndrome child cannot infect somebody with leukemia. And that's why we would put them together. Let me just tell you a few more things about the ATI. We have found, at least students have said, that OB is actually easier than the peds. Last semester, well, for the last 2 or 3 semesters, I've gotten about 11 to 13 level 3s in OB on ATI. A lot of students got level 2. Some students get level 1 or below level 1. Please remember, a test does not define you. If you don't do well on the first ATI, the second one I would say probably 75% of the students go up a level. It seems like the second ATI is a little easier than the first. So don't let this test define you. It's just kind of an indicator of where you are in your chances of passing the NCLEX. But I've had students say the NCLEX was sure a lot easier than ATI. Students that may not have done well with ATI scored beautifully in their NCLEX. So like I said, don't let one test define who you are. You are amazing. You're going to be great nurses. I've had an opportunity to meet many of you one-to-one with Zoom or in person. You're going to be amazing. So I'm going to let you go because I know you've got care plans to finish, a COTAC test coming up, all kinds of fun to finish the semester. So if there's anything I can do to help you, log on to Canvas, make an appointment with me, and I'll be happy to help you out. All right, Sherry, for sure, if you don't get what's coming for today, it will be after my 11 o'clock class, so look for it this afternoon. And I'll upload all of this. All right, peeps, I'm gonna let you go. Take care,
Thank
everybody.
you.
You're the best.
Thank you.
Thank you.
Thank you, Joyce.
You're welcome. Thank you.